a pediatrician with Hartford Healthcare, to get some answers. Thanks for joining us, Doctor.
Thank you for having me.
All right, I guess the thing is, let's start at the beginning. Why is there a baby formula shortage, and how long do you think it's going to last?
There's a baby formula shortage because Abbott, who makes Similac, had to shut down their production when there was contaminants, a bacterial contaminant found in them a couple months ago. There's actually 2 infants that contracted the bacteria that died. Oh. So they shut the plant down, which is really delayed making formula. Similac is a very big producer in the United States. So our WIC program in Connecticut has a contract with Similac or Abbott Pharmaceuticals. So that's why they have the shortage, and they have not been able to ramp up the facilities. And they also have to pass all the inspections to make sure that bacteria is no longer on the machinery.
I know even the president's involved. They're saying even using like wartime declarations to increase production. But in the meantime, you're hearing stories of people driving hours and not being able to find the formula that they need to feed their child. What are you recommending for your patients? I know people are Googling homemade recipes. Is that not a good idea?
It's an awful idea. Infants require a certain proportion of calories that are it's very regulated. You can really put an infant into intensive care unit by making homemade formulas. There's a balance of salt that's very important, and other electrolytes. If you do this wrong, they get too much water, they get too much of it. So please don't make your own formula. There's a lot of resources out there. Call your pediatrician. We actually still have some samples in our cabinet that we're by case basis. And also, I just want to tell people at this point in time, don't be fussy. You don't need to buy name brands at this time. You can buy the Target brand. You don't be fussy. Also, if you're breastfeed more, because the law of supply and demand, you will produce more. I know it's hard and you can't depend on that primarily, but a lot of my moms are both breast and formula feeding, and I'm telling them, amp up the breastfeeding, just get your baby through this. The other thing that some people are doing, you'll see on Facebook, they've created some Facebook groups for this, and parents are sharing resources. Parents that have leftover formula that's not open, they're offering it to other parents. Moms are really coming together right now, but there is a lot of fear. I had a call this morning from a mom of a 3-week-old who actually just tested positive for COVID also, this 3-week-old. And she is partially breastfeeding, but this baby was admitted over a week ago at Connecticut Children's Medical Center because of vomiting with the formula that they were on. And they are prescribed a Abbott-based formula, which they can no longer find. So it is a real issue.
Yeah.
It's really hard for parents right now.
And not only that, but on top of this, now we have to worry about price gouging and them people trying to make a buck off of other people's hardships. I don't get it. You're talking about babies here. Exactly. It's absolutely horrible.
There's a great article that I saw in the New York Times today, and just moms already have so much pressure, and they're probably feeling more pressure right now. But a lot of people, just breastfeed. Why is that not so simple? People who don't understand,
well, a lot of moms simply can't breastfeed. Or if they're, for myself, I have 5 kids. I breastfed till they were 4 months old, and I didn't breastfeed after that. Some parents breastfeed till they're 4 months and they're faced with no formula. They're not going to be able to start making milk again.
All right.
Can they relactate? I know there's a lot of threads on social media about how to relactate. Is that a realistic thing to try?
I don't know. How much time do you have? You got to simply be pumping 24 hours, I think, to start relactating. And it would have to have been very recently that you actually were lactating. It's extremely impractical.
Yeah.
To tell someone to start lactating. It's also extremely impractical at some of the stuff that I'm telling the moms, and I recognize that for them. It is impractical for me to say, just keep trying to breastfeed more. But we are in a little bit of a desperate time right now, so we tell people things that we know they're not really capable of, but we just want them to try a little harder. Moms are under an incredible amount of stress. To think that they don't have what they need, which we've counted on in this country for years and years and years and years, formula. They don't have it right now.
Do you know what? You might not know this, but in terms of the nationwide shortage, do you know how Connecticut fares in all of this? Are we doing better than some states, or not as good as some others?
I haven't seen any comparisons, but I can tell you in my practice, which we have probably 3,000 people in my practice, we are getting a lot of phone calls.
Okay.
3,000, they're not all babies, obviously, but we are getting, I just already this morning had 4.
Wow.
Wow. Now, I know also, I was reading an article that said, in a pinch, toddler formula to an infant, though it's not the best thing, but in a pinch you could at least do the toddler formula. What do you think of that?
I saw that also. It's hard. You want them to have something to feed, but toddler formula is not safe for a newborn. It's not safe for a 4-month-old. It's not safe really even for a 6-month-old. If your infant is, 11 months old, I think that's different. You could use the toddler formula. But for a newborn or even a 4-month-old, you really should not.
Right.
The imbalance of proteins, calcium, all the other macro and micro.
Donating their breast milk for those women who are so blessed that they have extra or this, is that okay?
Desperate times call for desperate measures, right? The only thing that we would say as pediatricians is that we test breast milk for infectious disease. This time I know that some of my moms are doing. I'm not sure that's not, but I'm not sure that it's okay either.
Yeah.
It's definitely not ideal. But
go ahead,
if it's between that and not feeding your baby, I would take another mom's breast milk.
Interesting. And forgive me for asking this question. Is one mom's breast milk different from another mom's breast milk, or is it all basically the same?
Well, it depends on what age her baby is. So when your baby's first born, your breast milk is very different than it is when your baby is 3 or 4 months.
How do you manage to work with 5 children? You are an amazing woman.
I have a very supportive family and husband, and my kids are great.
That's terrific. Well, we can't thank you enough for joining us today.
Thank you for having me. I appreciate it.
We'll talk a little bit more on the streaming channel for Kara's Cures, so we'll take a little deeper dive also. So thank you, Doctor. We'll catch up with you in a bit.